A case, if it is properly taken, will give you confidence and it will create an impression on the examiner. So, format you all know. How many of you are PGs? Fine. So, format you know. What are the points which we should consider? Next slide. First, it should be relevant and appropriate to the case. Say for example, you have a uvea case. You should definitely say positive findings and negative findings in slit lamp. Gonioscopy must, do not forget. IOP fluctuation, pupil very important in all cases. Okay, corneal sensation, don't forget. And finally, fundus, comment on the disc, macula, choroid and pars plana. Let us do one more example. We have an orbital case, neurophthalmic case, even certain squint cases. You have to get proptometry, ptosis measurement, extraocular movements including saccade so that we pick up some sort of nystagmus like Brunn's nystagmus. Here also corneal sensation, many often students forget. IOP fluctuation, hypotony, gonio not possible in hypotony. And if there is proptosis, post-action test. And in fundus, look at the disc for disc edema, pallor, opticociliary shunt and vascular changes. Vascular changes in the retina, the macula, choroidal folds and some lesions in the fundus. So negative is important in every case, relevant to that particular case. Next, it should be systematic and complete. So where do you start? You will start now. Exams are coming in January. So speak with your seniors and your mentors. Get a list of cases which are usually kept and then identify the salient points. Mesh it according to the age and gender. For example, bilateral primary optic atrophy. If it is a child, think about post-infectious, post-vaccinal demyelination. In a middle-aged, multiple sclerosis, pituitary, vasculitis, and in elderly, ischemia is the first differential diagnosis. So this has to be prepared well in advance. Time management. Everybody from KUHS? So know your university, know your time. So prepare well in advance. Start writing the case sheet, whichever be the case, whether it is you mesh it, you have already meshed it as long case, short case. So start writing it and at the end, always keep 10% time back for summarizing and planning the management strategy. Diagrams and colors will help you to avoid long description. Make it short, draw it and finish it off. Cornea, end-on section, cross-section, gonio, fundus, diplopia, wherever you can draw, you draw and finish it off. Summary should be clear and relevant. Most important point, do not repeat. So let me tell you one summary. A 47-year-old female came with pain, redness, defective vision of 3 days duration, history of similar complaint 1 year back, took 3 to 4 months to subside, needed systemic treatment, history of PT in the family, no relevant history pertaining to this particular case, on examination has asymmetric bilateral granulomatous panuveitis with acute exacerbation in the right eye, with hypotony, complicated cataract and cystoid macular edema, vision of such and such, pupil normal, diagnosis. This is the summary that we want. Okay, next. So finally, when you have a diagnosis, there are 3 components. All cases may not have these 3 components, like primary open angle glaucoma, finished. If it is secondary open angle glaucoma, you have etiology, you have DD, right? So in uveitis, structural diagnosis, we have already said, etiological TB, sarcoid, syphilis, VKH, all those things. And finally, if it was unilateral, we could have put a DD, chronic uveitis due to RD, like that. Okay, so with this, you should have a plan. At the end, you should have a plan for management in your mind, which includes investigation as well as treatment. Investigation, how will you say? CBCSR, RBS? No, it's not for postgraduates. You have to say leukocytosis, thrombocytopenia, then diabetic control, nephropathy, FFA for capillary non-perfusion areas, T sign in ultrasound. Like that, be specific and tell why this particular investigation you want. Management, what is the plan? You have medical management, acute management, adjunctive therapy, intervention, and finally the definitive surgical therapy. So this plan you should prepare well in advance for every case you may get during the exam. Once you start it, you will understand that there are groups in which same plan, same management works. So that is where it becomes easy for you. So you can expect adrenaline surge in your exam, So prepare well in advance before you sit in the hot seat. So with this overview, we'll take you through all different aspects of examination.